Hi, everyone. My name is John Effinger. I'm at Texas Health Institute, and we are so excited to have you here today. County Health Rankings is a project that we have been involved with for quite some time with the Texas Association of City and County Health Officials, and we will get started here shortly. You should be seeing a poll asking, have you used county health rankings in your work? And if you could answer that, that would be awesome. That'll give us an idea, folks, if you've been able to use this before. And we're going to give everybody just a minute or two more just to get in here and get settled. We have a really good panel today. And what's most importantly, aside from the panel, is we have a growing number of attendees. So we are delighted that you are taking an hour out of your day on a Tuesday to join us. And we have space at the end for Q&A, questions and answers. Also, you can use your chat to comment on, where you're from, what you're interested in, and also anything that's related to a question. And then there is a specific Q&A panel that you can use as well for us to keep track of the questions. Very cool. Chat's already starting to come in. Appreciate that. And absolutely agree about providing background information for grant proposals. That's a key resource that County Health Rankings has provided us. And what's really good about this year is there's some new data that we're going to talk about, or some new measures. And so how you can use that locally in your own community can become a new tool in your toolkit, we hope. Okay, we have a growing number. Very good in terms of the number of attendees here. So thank you again. And I think we all know this, but just to be sure, we are recording today. And so the recording will be up in the near future. We'll also have some documents that we have gotten from County Health Rankings and roadmaps that will be available. It's great to see some of the faces or some of the comments of folks that are here. Some folks we haven't talked to in a while, and some folks we talked to a lot. So great to have everybody here. And we'll get started here in just a second. And so once again, please be sure to answer the poll if you haven't done that already. And if you have thoughts or comments, please be sure to put them in the chat. And you can go in the Q&A or in the chat as well. Yeah, Katie, why don't we go ahead and share the results just so we see, and then we'll start screen sharing here. 54% have used it, and 46% have not had the opportunity. So hopefully this session today will be the tipping point to get you over there to start using it. It is a very valuable tool that we use in a lot of our different work. So great to have you here. So let me go ahead and go to screen sharing, and we will get this started here. So hopefully everybody can see that. I'm seeing some nodding heads from the panelists, so we should be good there. So again, my name is John Effinger. I'm at Texas Health Institute. We have a panel of really three terrific people that know a lot about what we're getting ready to talk about, plus in their own world, what they're doing. Ankit Sanghavi is the executive director of Texas Health Institute. Previously, Ankit served as a director of community health and oral health at THI. He provides leadership and direction on all of our THI initiatives and develops collaborative efforts at the local, state, and with national partners as well. Ankit earned his master's in public health from Texas A&M University in 2014, and a bachelor of dental surgery from India in 2011. His professional interests are research, innovation, and data in public health and healthcare. Jennifer Smith has 42 plus years of public health experience and currently serves as the executive director of the Texas Association of City and County Health Officials, or TACHO. Prior to her service in public health, she was in private practice as a dental hygienist for over 5 years. She spent 27 years at the Department of State Health Services. Jennifer probably ought to get an award for that. Including 10 years as the first executive director of the Texas Council on Cardiovascular Disease and Stroke. After retiring from DSHS in 2009, Jennifer became the first chief public health officer for the Texas Association of Local and Health Officials, TAHO, which was the predecessor for TACHO, and was in that role until August of 2013. She then assisted in developing TACHO, where she now serves as executive director. Catherine is the director of public health for the city of Lubbock. Since 2015, she has increased the department's visibility and impact by quadrupling the department's size and developing collaborative programs across the community with different community organizations to further public health priorities. During the COVID-19 pandemic, Catherine was recognized for her innovative leadership. Before moving to her current position, she was with Texas Department of State Health Services as a statistician, researcher, and manager. Catherine is also currently serves as the vice president for TACHO, Texas Association of City and County Health Officials, and is on the board of NACHO, the National Association of City and County Health Officials. And with that, I'm going to move to, I'll be mute for a while. And Ankit, it is all yours. If you'll just let me know when to advance the slide, that would be awesome.
Thank you, John. Yes, I think we're at time to move to the next slide. Again, thank you for the introduction, but good morning, everyone, and thank you for joining us today. Excited for today's discussion and really honored to be on this panel today with Catherine and Jennifer, and look forward to sharing more about the 2022 county health rankings and how it can be used as a tool in your efforts of advancing health and opportunity for all. However, before I dive into the county health rankings framework, I do want to take a couple of minutes to share a quick overview of the Texas Health Institute, and that brings us to today's discussion. To set things into context, we are an independent public health institute here in the state of Texas with a vision of healthy people, healthy communities, and a mission of advancing the health of all. However, central to this pursuit is our commitment to health equity, and that is ensuring everyone has the opportunities free from barriers to achieve their optimal health. More so, it centers everything we do and how do we do it, while focusing on our three priorities of advancing health system transformation, strengthening public health infrastructure, and promoting healthy communities. Next slide, John. As a Texas-focused and a nationally engaged organization as a member of the National Network of Public Health Institutes, our strategies include leading through research and evaluation with a growing emphasis on community-driven and applied research, coupled with our strategy of translating data into action. And with the idea that none of us can truly move the needle on systems change, it's all about collaboration, is advancing collaborative action and providing capacity building and technical assistance support for achieving sustainable change. Next slide, John. And in doing this over the years, we have been grateful and encouraged with the opportunities that we as an organization have continued to have to play our part in moving the needle on health and opportunity through our efforts at the local, state, and national level. What you see on the screen are just a few examples of our work in the last year and a half through the pandemic that shows the effort and the impact at a systemic level. Next slide, please. And as I talk about these efforts, really what brings me to today's discussion, and as we release the 2022 annual county health rankings and roadmaps for Texas, and share that in a way, or the intent that how can we use today's discussion to leverage these rankings as an opportunity to identify, explore, and advance efforts that improve the health of all Texans. To set some context, and for those of you not familiar, again with the initial poll, we have about a 50% of our audience that is still not been using or very familiar with the County Health Rankings platform. So I would like to take a couple of minutes as we look at this slide. Is that this model really illustrates a broad vision for health. It shows that policies and programs at the local, state, and federal level play an important role in shaping health factors that too in turn influence our community's health outcomes. These factors represent things or contexts that, if modified, can improve the length and quality of life. Again, this is really a measure that's central to the rankings or the model that is the County Health Rankings. These factors include or are predictors of how healthy our communities can be with a forward-looking vision, and this include health behaviors, clinical care, social and economic factors, and the physical environment. Health outcomes, again, represent how healthy a county is, and they are a reflection of the physical and mental well-being of the residents through measures that represent the length and quality of life typically experienced in the community. Again, this has been central to the very evolution of this platform and how it can be used to truly not just identify strategies, but move or shift mindsets on what really achieves health. Next slide, please. To further expand upon this, and again, this is a work that's or a platform that's been in action for over about 15 years. And to further expand on my earlier point, I would be remiss that the rankings is not just limited to a measurement tool. It truly can be used as a valuable tool for change, because the platform is designed to not provide just the data, but linked with the data are strategies that each one of us, irrespective of our role in community setting and as our strategy aligns on community health improvement, there are evidence-based strategies, examples, tools that help us identify those and bring that into action and implement in our communities to help move the needle on many of the outcomes or measures that shape up our county health rankings and outcomes. As you navigate through this year rankings, I would encourage you to explore the Take Action to Improve Health section on the County Health Rankings page to help you identify those strategies that may be applicable for your community and to help you achieve change. Next slide. Furthermore, particularly for this year, I'm excited and encouraged with the addition of new measures that really help expand the use of this tool and this platform in identifying needs and opportunities that advance the health and opportunity for all. These measures, as a point of clarification, are not part of the actual rankings. They're intended only to serve as a resource, given the growing need and emphasis to advance policies and actions that can directly help improve health outcomes. Again, going back to the fundamental idea of having the health rankings and its approach on what delivers or achieves health. To further expand upon this, John, if you could advance to the next slide. I won't go through each of those points, but I particularly wanted to lift up the inclusion of measures on childcare. What you see on the map, and as you can see in one of the bullets, there is significant disparities in Texas when it comes to childcare, and the map represents the ranges in that cost burden across the state. This is one component of economic security, again, a growing emphasis with the addition of these new measures. And for the platform, they define the economic security as ability of individuals, families, and communities to support their health through the means to afford basic needs such as housing, education, childcare, food, and medical care. When a single household expense, which happens to be the case when it comes to childcare, consumes the majority of a paycheck, more often than not, individuals, families, and communities find it difficult to meet the competing needs that can fold households, families, and broader communities into tough decisions between choosing between quality childcare or nutritious food. Economic security is not equally accessible to people living here in the state of Texas, and this is actually a reflection that we see as we look at the data for the country. Next slide, and I believe that brings me to my part of the presentation. That in closing, I do want to highlight that, again, given the name, it can often be confused with the county health rankings really having a geographic unit of focus. But again, with the evolution of the platform, we have seen not just addition of new measures, but the ability for us to actually analyze the data and break it down by race, ethnicity, for example. And what we see is that there are significant disparities based on racial ethnic distribution of the different data points or measures, which really help us further expand or grow our understanding on what do we mean when we say we need to be growing an emphasis on an equity lens. And really this tool can be used as a framework. But again, this is not something that's a new framework. It's been a work in progress, as I said, for at least the last 15 years. And we have seen significant successes, and it's used across the state of Texas and the country. And really leading these efforts from the forefront have been our local health departments. And for that reason, I've been very excited for today's discussion. And I think it's a wonderful segue for me to introduce and pass it on to Jennifer to help share and lift up some examples and strategies from our local health departments that have used county health rankings as a tool for engagement, as a tool for change, as a tool for measurement and action. So again, thank you for joining us, and Jennifer, on to you.
Thank you, Ankit, and welcome from the Texas Association of City and County Health Officials, or as we like to call ourselves, TACHO with an A. Just a few little facts, and then I'll move this on to Catherine. TACHO is the member organization of local governmental public health agencies across Texas. You can see the different configurations of types of health departments, and they also are in different sizes from 5 employees to 700 employees. So no matter what, whether they're a city, a county, or a district, overall, they represent a jurisdictional population of 20 million Texans. And that's their responsibility of providing services in those areas. Our pillars in TACHO include leadership, education, advocacy, and develop, all to improve public health and local public health in particular, to create a healthy Texas and healthy Texas communities. So I'm very pleased that Catherine Wells, our current vice president, who will move into president in October, is here to share some of the stories that we have seen in the local level on the use of the county health rankings. And I also want to thank THI. We've been a partner for over 10 years on this, working together. And so I'm excited that we're able to bring this webinar forward. Catherine?
Well, thank you, Jennifer, and thank you, THI, for having me here today. It's really great to be able to bring in a perspective of what's going on out here in West Texas. Being west of 35, people sometimes forget about what happens out here, but I'm up in Lubbock, Texas, home of Texas Tech University. So that's usually how most people associate us. We're actually a county of 300,000 people. But we are an urban center that's really surrounded by rural areas. And that really makes, we don't have a lot of local government public health infrastructure up here. So the work around that's done in Lubbock, and then also the work by my colleague Casey up in Amarillo, are really the 2 core public health government entities out in this area of the state. When I came in to public health here in Lubbock as the director, my goals were really to strengthen our local public health system. Our department had been really demolished by budget cuts. So I really wanted to build our capacity and increase our programming. We also want to do a lot of work around engaging community leaders to think about public health when they're setting and implementing policy. Really working around encouraging local investment in public health, not just being dependent on state and federal funding partners, but getting that local investment. And then a lot of education around how cross-sector, multidisciplinary work can have a high impact on our overall community health. And it can't just be the public health department alone. So over the last 7 years, we've seen a huge increase in the number of public health employees here locally. I've gone from 10 to 50. We've quadrupled our funding. And in order to do that, a lot of the conversations I've had with our community leaders, hospitals, county judges, is really around the county health rankings. I use that as a good data source to really look at our trends. This model has really helped us to explain to those stakeholders that health is just not access to care, and that it's our behaviors such as tobacco use, exercise, those social economic factors like education, social support, and housing that really can make a difference in the overall health of our community. So when you go and dig down in the Lubbock County Health Rankings, you'll see that we have really positive clinical factors. We're in the top 25% when you look at things like the ratio of medical providers to a population. We have a fairly decent rate of insurance coverage out here, and we have fantastic clinical data when you look at preventable hospital stays. So that's kind of one side of our health rankings. But then when you look on the other side, we have some really crappy health outcomes. We have traditionally ranked in the bottom 25% for measures like premature death, poor physical health days, poor mental health days, and infants born with a low birth rate. And as a public health director, this disconnect between these two, so we have good clinical outcomes, but our overall public health measures are pretty poor, is really frustrating. But it's also started some community conversations. So we have our doctors, and we have doctors and mental health providers here in the community. However, our individual community members aren't getting to those providers. And that's really started some community conversations on how we can better link individuals that are at risk for poor health outcomes into the medical care. And really having those discussions around the community health rankings and that disconnect has really allowed us to leverage local funding for two large projects that we have going on here in Lubbock. The first one is LBK Community, which is an electronic network that allows us to link people between our hospitals, medical providers, and social service agencies. So it's basically like an EMR, an electronic medical record, but it's for social services. And we now have 40 individual agencies on this network, and we're all sharing client information. So if somebody presents at Catholic Charities and maybe is in domestic violence, we can put them with Women's Protective Services and get them services, link them up with our food bank so that they get their services. And then that's all documented so the different case managers in town can see what's going on. And we've been able to do that through talking about this disconnect. Another large project we have going in the community is the creation of a mental health diversion center. So having these community conversations about how poor health outcomes are really linked to other issues in the community. We've been able to work with our MHMR, our county jail, and our police department to look at building a diversion center. And we're actually going to be using ARPA funds to create this center. But it's going to be a place where the police, if somebody's under mental health duress or substance use and they've committed a minor crime, we can start taking them to the diversion center instead of the jail. And that diversion center will really create a place for connection for those individuals at risk to get them into all of the different social service agencies in our community and also linked to access to medical care. So really, I really went back and started looking at some of my old slides, and I have old county health rankings from 5 or 6 years ago where we started having these community conversations, and continuing to have those discussions has really led into us being able to bring in some local investment to create these new programs.
Thank you, Catherine. And we're going to go to questions and answers in just a second. But one thing that these webinars do not just happen. And so we're fortunate with that in THI to have 4 terrific people that help us put this together and get the word out. So we want to thank Stephanie Andreas, who is our Chief Convenings Officer, and Katie Bradley. The two of them put on in-person and virtual events almost all the time these days, it feels like. Kanika Sahazavan, who is our Director of Communications, and Megan Varghese, who is our social media guru. And so Without their support, we wouldn't be able to have the really outstanding attendance that we have today. And so I thank you to each of them. And I echo in reverse what Jennifer said. This has been a terrific partnership from the very beginning days. And it's always a pleasure to work with Techo and the folks that are involved in it. So with that, we've got 3 questions in the Q&A, but we also had 3 questions beforehand. So I want to go ahead and we've got some resources on that. So for the 3 people that sent in questions early, thank you for that. And I'll drop chat answers into the chat from the County Health Rankings folks, because they gave some resources in there. One was, please spend some time on maternal care resources, coverage, and outcomes as it relates to new mothers and babies. And so I'll put that in the chat in just a second. There's some resources there. A second one is, what are ideas to get cities and county government to work together and not compete with one another to improve health equity? And so that might be a good one for Ankit and Catherine and Jennifer to tackle. And then we'll also answer, how does this year's focus on the social determinants of health and how that changes over the previous years. There is 2 documents that we will load up on both our website and make available so that you've got those publications that talk about the changes that we have there. And as importantly, we'll also be sure that you have access to the Texas report if you haven't had a chance to pull that down. So let's talk first about how can communities work together, and then we'll go to the other questions in the Q&A.
Catherine, do you want to take the lead?
Yeah, I'll go ahead and jump off there. It's all about relationships. Part of when I first started as health department director, we're about a year in, and we really looked at that disconnect between our health outcomes and, length of life and some of these other things through the county health rankings. Myself and one of my staff, we literally went to every nonprofit in town. We made a list of them, called them, said, do you have time to meet with us? And we went out there and talked about that disconnect and said, how can we address this as a community? And that was really the basis that launched our LBK community program. And then with building the work with our mental health authority and our county, it's really about talking to them, getting public health at the table, and getting them to understand how the work that they were looking at could really affect the health of the community.
Jennifer, not sure if you wanted to expand. I would echo everything that Catherine has shared, and really the response on relationships. But also, again, I would emphasize one of the earlier points I made, that this rankings is an amazing tool to have the conversation. I think we can all agree to disagree, but again, a beauty of the rankings platform, for what I've been using it for a good part of the last decade, is the ability to visualize this data in maps, where we cannot just unsee what we have seen for what the data portrays, but more so the emphasis, again, the framework layers on non-health factors. And the question specifically speaks to how the cities and counties can work together. Again, when you look at the broader systemic issues, or something such as local economy, or the housing infrastructure, or the built environment, the city and county blurred lines really don't justify a segregated response, and really the actual solution is working together. And this platform, again, with that data, makes this more of an objective conversation to build on those relationships and move towards action. So it's if I may say, like the soft skills or soft attributes of public health that really come into play as we start leveraging the potential that county health rankings has to offer. But that's it. And Jennifer, I'm not sure if you would want to expand.
Sure. What I would say from a broader perspective of looking at this and working with our members, there is a concept out there about having a chief public health strategist in the community. And what this person does, and usually the local health department for their local community serves this position, is that convener, that coordinator, that trendsetter, if you will. But what they do need, as Catherine mentioned, is data. And data helps to set the stage, to provide the information on what the issues are. And so I know that our members do that pretty regularly. They build those relationships within their communities, and they also build their state and national relationships as well, because many of the things that do happen affect us from a national level. So if you're in a community that you can go to our website, the THO website, and identify if your community has a local health department in it. And also on the County Health Rankings website, one of the easy things I do is because I oversee the broader membership, but I live in Travis County, to look at my data, I just put in my zip code. That was kind of the easiest thing to do. Or I could go back and look at Texas. And then I can go and look and see our counties and how Collin County and Denton County always seem to rank well in the county health rankings. I don't know if anybody from their local health departments are on, but they're doing something well up there. And so if you live in those counties, I would check in with those local health departments.
Thank you. Let me drop this question in the chat. This came in through Q&A. Can you walk us through how to use data? I'm not able to run any analysis. What am I missing? There's a link to using data. So if we can take a look at that, that would be a good start. And then we have several more questions as well starting to come into the Q&A.
Realize I have to unmute. Again, happy to take the first stab at it, and Catherine will invite you again, given your background with statistics, to see if you would like to expand. But thank you for the question. Again, I would emphasize that the idea of county health rankings is to the simplest way to actually get to the data profile for your county is go and explore health rankings, explore your snapshot, which is the link that the attendee shared with us. There is a list on the left of your screen. Go and explore your snapshot. You can choose your county and get the county profile. However, many of these measures do have data broken down further, or the ability for you to analyze it for different populations or subpopulation and running some trends, which is where I would encourage you to again look at that list on the left of your screen once you go on this link, and there is the section on go beyond the snapshot. If you click on that, you will have two options: is dig deeper, which allows you to again find the list of all the data points in the platform that can be broken down by different measures or factors. And also there is the second page which says find more data, will help you identify additional data sources that maybe not be part of the platform, but speak to one of the measures that's part of this framework and this tool. Hopefully I answered your question, but again, Catherine would invite you to chime in if you have anything to add.
I think the most important thing is really to take some time and spend time with the data. And I really like how I can look at certain variables or measures and then really look at where those data sources are. So I really have a good understanding of what's going in to the different measures in our community. And really look at, I really like all the different tools in there and the mapping, and being in such a rural area, I really start looking at what's going on in the counties that are surrounding Lubbock also, because they have such an impact on health in our community, because all of those counties come in. So it lets me see just what's going on locally, but then I can also expand that out to our regional data.
And Katie, can you give Jennifer some screen sharing capability real quick? Jennifer, I think, is pulled up. Perfect. Travis County. Yay.
Okay. Now how I got here, I could go back and try to, to do all that, but basically on the front page, as I mentioned, you can scroll down and it says find your state, county, zip code, area. And like I said, this time I put in my zip code. So that brought up automatically Travis County. And then what you can see here is where it's ranked, and we're not bad. In Travis County, we're doing pretty good. You can also see on the left side, I think Ankit was saying this, the various separate counties if you wanted to go to a different one. But as you go through this, you can start looking at your county demographics. And what I like about this, they give you these little trend numbers that tells you if you're going well or you're going not so well down here. Sexually transmitted infections, which has been a discussion point among our members, that during the pandemic, we have seen increases in sexually transmitted infections. So interesting, it pulls up here on the website. The other thing I wanted to show, so what you can do, you can look at Travis County and you can look at Texas and just kind of get a sense in general for yourself what how you compare to Texas overall. You can go into more detail with each of these. It will, I'll just click on it. It will kind of give you a sense of what the state looks like, and then you can go down into the data. Obviously, the dark blue is the worst. The lighter blues are the better areas. Go back. The other thing, though, I wanted to show when they were talking about some of the new measures, that some of these are not included in the rankings. These are in the rankings, but these are additional measures that you can look at that could be very helpful in your decision making or in your discussions of what does your area look like and how does it compare. And one of the interesting ones, let's go down to health behavior. No, I wanted to go down to the social and economic factors. Here's a long list that are not included in the overall ranking, but that you have data on. And so you can then click on each of these, and this will take you to another description of how they arrived at that data and what it could mean for your community. So just don't forget that there's a not included an overall ranking area that gives you access to other information that can be very useful in your discussion points. Hopefully this was helpful. How I got there, well, let's see, I probably started up here at the beginning, went down here, that's the main page, entered in my, and there was Travis County. So you could enter the county, the state, whatever. Now, I don't believe we can connect, I don't think you can compare between states, but you can compare between counties within your state. So that's another feature and function in there. I'm not even going to try to do that one. But if you want to look at a neighboring county or a county that is maybe closer to your demographic makeup, then you might be able to, see how they're doing in there. That's kind of interesting to look at the perspectives.
Thank you, Jennifer. Great example from all three of you. The next one I've just dropped into chat. This kind of goes to the conversations we've been having among ourselves. How integral would you say the rankings are in creating your health initiatives, and how has county health rankings and roadmaps influence the creation of policies in your county or in your community? And if you have some examples, it would be great to kind of cite through that.
Catherine, do you want to take the lead?
Yeah, besides I'm trying to think how to phrase this. I really think looking at those individual rankings and where we fall compared to the rest of the state has really moved the conversation around health in our community and really addressing more, bringing in those social determinants of health versus just talking about how many people are in the hospital or how many hospital beds we have. It really brought in that social part. And that's how we use those rankings.
I would just add that from the state level, THI and us in the earlier years looked at the maps, we looked at the colors, and we targeted the communities that had the darker colors that might show that the outcomes were not as good. And we would go out there and provide a presentation to the community to bring in their key leaders and discuss how the rankings could be viewed for them and used within their community. And I think some of them have then taken that information and focused on certain programs or tried to identify certain resources that they wanted to bring into their community, similar to what Catherine has described. John, you remember those days?
Yeah,
Absolutely. And I was just thinking, as you said, that George Roberts and some of the other people that we worked with back then of the day. So yes, absolutely.
and I wanted to kind of tag on there to Jennifer's comment. Out here in Lubbock, because we have that disconnect of our outcomes in the two different measures, we usually fall about 50% when you were looking at those old rankings. But if you go and really start digging into that data, you can really start seeing those disconnects. So we always look like we were doing okay because we have such good clinical measures. It really pulled up the state county, whereas there's really some things that we needed to be addressing.
Well, and one of the things that Jennifer reminded me of as we talked through this is it's not where you are in the overall rankings, it's how you can take steps to improve individual pieces as you go through that. And at some point that's going to improve the rankings, but the real core piece is how do we do something on individual data points that we can improve on? And we'll have a question to answer in just a second on those. Yes.
John, just to piggyback on that and the point you raised, and CHR&R role as a public health institute, really the way we have used the county health rankings is to identify needs and opportunities across the state and work specifically with counties across the state. But one potential opportunity that we would love to see other counties in the state replicate or build upon is what we have done in the last couple of years with counties in East Texas, working with the local leadership to utilize county health rankings again as a tool for engagement to first expand their understanding of what may be needed and where opportunities lie in making investments, not directly in public health, but in other sectors or areas of the community that will actually have an impact or potentially have an impact on health outcomes. And that work led us to kind of looking at trends in county budget allocation and county health rankings improvement. And we were able to draw some relations, but really what led that as a project towards an outcome was the process of building a health in all policies approach at that local community county level. So again, it's a tool that can be perceived from a data standpoint as part of comparing a county to other counties and identifying needs or disease burden. But also, if we really expand our vision about this tool, it could be leveraged as a tool for engagement and really driving or identifying efforts in another way than we traditionally perceive in public health. So again, I would encourage to think beyond this as a measurement tool and a tool for engagement and change.
And I get that's actually, and this wasn't planned, a great segue into the next question of the chat. Catherine, that's yours, but then Ankit, you might want to talk about your thoughts on even things like Aunt Bertha. But Catherine, can you share the name of the program or platform that provides the linkages to the various agencies?
Yes, so We rebranded it as LBK Community. Right now, we're in a partnership with a company called Signify Health. They also are doing some work around San Antonio. And then we're currently in the process of, that's when I have to go out for rebid. So I don't know if we'll be able to stay with the same company or we'll have to switch. But really, their goal is to look at social determinants of health and really provide that platform to link individuals. And we, after about 2 years of working and developing the network around the platform, we were able to get our large public health hospital, our public hospital, as part of the network. So now they're using the network to refer out all patients that are discharging into the social service agencies. And we've seen a huge increase in the number of people utilizing the system when that happened.
And I think you have some thoughts really on how do you begin building linkages at the community level to share resources. Thoughts on that?
Again, to one of the earlier points that Jennifer raised, that county health rankings is a composite score, but once you actually look at your county ranking and then you see the distribution of burden across all the different measures, it helps you identify really with the emphasis on social economic needs of the community. And in many which ways, this tool has actually been a contributor to the conversation around the whole healthcare shift when we talk about moving from fee-for-service based to value-based systems that help address social determinants of health. This tool has been a key contributor to that narrative change to begin with. But it's through efforts such as this and many other platforms that has led to the creation of, John, you mentioned Art Bertha as one of the offerings or providers of linking social services and individual needs. Signify Health is another platform. Unite Us is many. And again, it's a growing community of these providers that continue to grow. Many of them work more closely with healthcare providers or payers, but increasingly, especially over the last couple of years since the pandemic, we have seen a growing adoption and linkages with public health departments. Especially, again, as I said, like the pandemic has really positively catalyzed many of these relationships and innovation. So I'm excited, but again, county health rankings is a contributor as part of facilitating that change.
And that kind of leads into one of our good friends just raised this question. If you had to think of 5 top data points, what would they be? And the other thing to think about maybe not as part of this answer, but for us to go explore some of the new measures that are out there, because that's given us tools that we've never had before and thinking about things at the community level. But Ankit, you first, and then Catherine and Jennifer, any thoughts in terms of what are the key data points somebody ought to look at?
Again, I wish I had a direct answer to this. Each community is different. And that's, again, how this tool helps us actually appreciate that. When we start looking at and spending time on this platform and really comparing counties, we see how different counties fare differently, which has an impact on their overall outcomes. So I wish I had a consistent list of 5 indicators I would want to go to and compare for each county, but I think that would be unfair to not realize and actualize the local context. So don't really have a direct answer to this question, but Catherine and Jennifer may save the day for me.
Yes, thank you, George, for your question. Let's see, I really look at the things that as a public health department, I can make pretty quick changes or a little more able to tackle. So really we always look at the STD rates because we have a high rates here in Lubbock. Also looking at the smoking. Teen birth is very key to me. I like to pay attention to that measure because it has a lot of impact on the future health of our community. And some of the education, the ones around education. And I'm very interested in digging down into the COVID mortality rates. I really wish those were in a map though. They're only listed as a line listing. So hopefully we'll see those out in a map soon. I'm really interested in looking and comparing my county rates with counties in other states. I've talked to some of my other health department directors, and they've had fewer deaths than what we've seen in Texas.
And that kind of goes to another question somebody had on, can you compare county to another state or states to states? And yes, Jennifer, any thoughts on that one? And then I'll drop this next question in, which I think is going to be in the methodology. But Jennifer, before I jump into that, any thoughts?
I'll just follow up a little bit on from Catherine, in that I look at it from kind of a statewide perspective first, because that's our membership as a whole, and that's where I came from. And so it's the groupings, it follows along what Catherine was saying. I'm sort of looking at the communicable disease rates in the rankings, and then I'm looking at the chronic disease rates in the rankings. And then I begin to look at the map, you know, for the colors, because that's always just a very quick viewpoint. And then from that, as she was saying, then you go down to your community and you figure out, well, what is really affecting us, and where is our lack of resources, maybe where's the lack of attention in there. And so there may be something that is happening and there are resources for it, but it is still not ranking well. But there might be another area that is in lack and doesn't have a lot of resources for it. And so I think it's just this whole, you know, community planning process of looking at the data broadly and then honing it down, and then determining locally or even on a statewide basis, you know, where are our gaps, where are we missing, where could we go maybe to offer potential resources. And I don't compare us to other states. I just kind of think we're who we are.
Can someone tell a story about how they successfully used this kind of data to persuade an elected official to promote health promoting policy? And we have about 3 minutes left in the Q&A. Catherine, you want to talk about your experience and your building programs?
Yeah, really the conversations, it hasn't been to change a specific city policy or county policy. It's really been trying to get them to invest in public health programming. So those conversations have been in order to, you know, run this platform to better, you know, link people to all of these different services. We need X dollars, or we need this investment. And it's also come from, we also use a lot of this data to apply for grants, but we also have to convince our leadership to allow us to apply for grants. So it allows us to have those conversations, so that then they're allowing the program or the department to build out those programs.
Starts the conversation. Ankit, is this kind of what happened in East Texas as well?
Yes, particularly we did work with the county judges in those counties in East Texas, but also like at the beginning of the pandemic, I mean, where data was being sought, there were a few data sources that actually pointed us to like what needs to be the focus in terms of response to the pandemic, or in the advanced stages or later stages of the pandemic, when the conversation and emphasis shifted towards vaccination. Where do we begin? Again, this was one of the data sources, again, in that early stages, that helps us have that conversation. And we were able to do that with a couple of counties here in Texas, working directly with elected officials, seeking that information, and then them running with it in terms of their decision making.
Jennifer, any thoughts on that?
I was just thinking that in some of our trainings and presentations where we present the data, what also factors in is community interest and perceived community needs. And so that's not in these data rankings, but it's something that has to be considered when you're presenting the data, because they may have a different viewpoint and a different need that they're looking at. And so it may start the conversation, which is what we intend in the first place, is to get the conversation going about public health, about health in general, and then moving into action from that perspective.
One thing is we begin to close out, getting close to the hour. Again, this is recorded and we're going to have this up, and also want to recognize Shannon Richter, who's with DSHS in the regional office, who also has been very helpful in getting the word out to all the different regional offices in this project. And so it's kind of a closing piece. We've got just a few minutes more, and Katie's going to put the link to the survey in the chat shortly. But Ankit, Catherine, Jennifer, any closing thoughts in the last few seconds here as we end out it in the last few minutes?
Catherine, Jennifer, if you want to go first, I'm happy to close.
No, I just, I appreciate the work of the Institute. I really appreciate the work around contacting county judges, because the areas that don't have local public health departments, those are the ones that really need the education about the importance of public health. And I reach out to my local county judges that touch my county, but getting it out into those rural counties is really important.
And I would just say that as you look at this data, begin to use this data, I think there was a question about the, how recent is the data. And what happens is that at times you have to use the data that you have, at least that's been collected at the national level, but you can also do your own local surveys and collect your own local data. And that could be a very useful process. And I know THI has maybe some assistance in that. And you can certainly reach out to TACHO if you're in a community with a local health department that's a member.
Jennifer, Catherine, first of all, thank you for joining and the opportunity to be on this panel with you. Thank you everyone and the attendees for spending your hour with us. We hope this was useful to you. I would just echo the thoughts that Catherine and Jennifer has shared, that this is, hope this has been useful to you, and as part of our commitment and in service of our mission and in support of your work, happy and committed to help and work alongside each one of you to further explore this as a resource in your work, but also how we can be of assistance to help you identify and advance solutions or strategies directly, indirectly in pursuit of our shared mission of advancing health and opportunity for all Texans. So again, thrilled that we had this opportunity. Thank you for joining us. And as with everything else, please feel free to reach out to me or any of our team members and our friends at THO for anything we can do to help support your work. But John, again, thanks to you for moderating this discussion, and back to you.
Let me, and thank you for that, Ankit. Let me do something that, let me put it back up here, because there is a contact slide. Whoops. If you all want to take a screenshot of that, that gives you the contact information that Ankit was talking about. And again, we'd love to hear from you. We've had a really fascinating and very collaborative and collegial relationship with County Health Rankings. And they do a lot of work in the 3,200 local jurisdictions. And we're just glad to be a part of that. At the same time, we were not able to get answered. We didn't have enough time, but we'll try to work on some of those and figure out how to get that information out. And the last one is Stephanie and Katie have put the links to the survey in the chat. Please be sure to take the survey. This helps us improve what we're trying to do. And with that, yep, there it goes again with the survey link. With that, we're right here at the hour. Let's give everybody maybe a minute back in a second, or let you all close out. But thank you for being here. This, I think, has been one of the best webinars that we have done for County Health Rankings, and really thrilled to be a part of this. And thank everybody for being here. Hope you have a great rest of your day and week. Thank you.